I'll get more into some of the other things in a moment. But several things have been going on in our state where everything seemed to culminate in terms of how we are not meeting the needs of our communities when it comes to individuals who have a mental illness and their families. And we are not meeting the needs as much as we hope to. First of all, the state was sued about a year and a half ago by the Legal Center for Persons with Disabilities on two fronts. The first is that many individuals who were in court and the judge had ruled that they needed to be evaluated for their ability to be able to stand trial, their competency to stand trial, were sitting in jails up to 3 months before anybody even got around to coming over to evaluate them to see if they were competent to proceed. That was one group. The second group was that of those individuals who were evaluated and found that they were not able or competent to proceed with trial, that the judge would rule that they be restored to competency, but they were on a wait list to get into the Pueblo Mental Health Center as much as 3 and 4 months. We lost, obviously. Well, let me rephrase that. That's not true. We settled with the Legal Center, and we came up with this idea of having a 20-bed unit in a jail cell, some county who wants to bid on it, who would like to provide that services. There would be 20 beds there to do the evaluations in the jail in a timely manner, to do the restoration for competency to stand trial in a timely manner, which then would free up 20 beds at Fort Logan and 20 beds total at Pueblo and Fort Logan. Open those beds up, which then would allow our mental health centers, again, to be able to refer people into mental health. So, because there's a backup effect when you don't have these beds available. So that happened. Then we had another piece happen, and that was in 2010, the legislature passed legislation that required the Office of Behavioral Health to do a study all around the state as to what is our crisis response system and what do we want to what do we already have in place and what do we want to see when it comes to a statewide crisis response for serious situations when individuals are in a mental health crisis and their families are in that position. And the report came out in January of 2013. It's online, you can get it, it's available to the public. And what it, in essence, says, among other things, is we don't really have a statewide, organized, coordinated crisis response system. And for those of us who've been in mental health for a long time, that is not a shocker. Right. We've known that. So those two things came together, and then we had, of course, some more tragedies in our state. And we had a very serious tragedy last August. The governor said, we've got to do something better, we can do something better, let's look at something better. And so last December or so, he held a press conference, and much of what he said there is on this outline on the very front of your packets. This is the $18.2 million that the governor had requested. It includes housing, funding for housing, establishing at least five regional walk-in centers, crisis walk-in centers, 24/7, fully manned, regardless of payer source. So this is not just the usual public health system where you have the Medicaid folks taken care of, or you have some indigent care going into the hospital. This is regardless of your payer source, whether you have insurance, whether you're on Medicaid, whether you're on CHIP, or whether you're on Medicare, or whether you're in private pay. This is supposed to be a service available to everybody. And it is required that they have community supports as well. Well, we were ecstatic because for decades we have been cutting mental health. We have not been putting money into mental health. Colorado is not alone in cutting money. This has been going on for decades. Since 2009, when our national budget tanked and when our economy tanked, every state in the union cut mental health funding. And since 2009, the total figure of mental health cuts, cumulatively of all 50 states, is $4.6 billion. That's with a B, billion with a B. Some states cut more than others, but that money has been cut just within the last 3 years, 4 years. since the economy is tanking. So rebuilding what we've been doing in terms of cuts in Colorado is where we could go, and we're excited about it. I have not seen in the 2 decades, longer, 2.5 decades that I've been here at the state legislature, or even a little before, this kind of request for funding. So on the back, when the department presented to the Joint Budget Committee in our state, and the analyst for the Joint Budget Committee made his presentation, he said, you know, one thing that is not in this request at this point, but that we feel that it's important to have, because where he looked, all across the country, crisis response will not work unless you have mobile units. Whatever you want to call it, a van or a car that goes out to the crisis point and defuses the situation, talks to the folks, talks to the family members, talks to the individual in question, and then is able to transport them back if necessary to the crisis center. And so and also additional housing. So he suggested an additional $9.5 million, and the Joint Budget Committee unanimously approved it, which is in and of itself a miracle these days. And so our total figure now is somewhere around $28 million for, maybe not quite 28, but just about $1 million for this investment. And we're thrilled with that, and we are very grateful for that. And I'm going to turn it over at this point to Maria. She can talk a little bit more about where the department is in terms of how they're going to manage expend the funds when the budget is passed in July.
Thank you very much
You bet.
for inviting me here today, Senator Miller, and also to the group for having me today. Dr. Clemens sends her regrets. She actually had plans this afternoon, although she did plan on coming with me if she could, so apologies for that. I'm so pleased to be able to come and talk about the initiatives. What an exciting time for behavioral health initiatives in our state. I joined the Office of Behavioral Health about a year ago now, and actually was the CFO of the Institutes, and was put into this wonderful role to be able to advocate on behalf of folks that are facing mental and behavioral health, substance use issues in the state. And I consider this a very cherished role in my life, so I'm pretty excited about that. I always like to give a little bit of my background so people know how committed I am to carrying forth these initiatives with all of individuals that you may know who have been touched by mental illness or substance use disorders. My sister suffers from schizophrenia. She was a victim of domestic violence over 40 years ago, and as a result of the trauma, did develop schizophrenia. And there's no hope for her. She will never recover. There weren't the types of services that we're trying to put forth here available to her at that time. So my personal mission and goal is to make sure that we really make these initiatives robust, or these services robust in our state. And as Mo likes to say, we get the right services to the right people at the right time. You've probably heard Director Rika say that quite often, but our office is fully committed to support these initiatives. And we have established steering committees for each of the initiatives that have involved not only leadership within our office, but also leadership of individuals in the provider community and also key stakeholder and advocacy groups, so that we make sure that we listen to the ideas that everyone wants to put forth. These steering committees are well underway, even though funding has not been distributed just yet. The funding becomes available July 1st through the Long Bill. And I'm here to say we have a New Year total of $30.7 million to invest in behavioral health in Colorado, which is just, really, and it wasn't just the work of the office. One of the things that I really like that you said is that we looked back in 2010 at what we really didn't have in the state. We weren't reacting to the events this past summer. This was a well thought out plan, and I think that's really important to note, because while the initiatives were put forth as a result, and the governor had a renewed interest in putting a lot of new funding into behavioral health, there was knowledge that there was a gap in the state of Colorado, and the plans were built based on years of research. It wasn't just a knee-jerk reaction to available funding. These are well thought out, comprehensive, very integrated programs. So I'd like to take a little bit of time and just talk about each one and where they're at. There are different phases of development thus far, because when funding was requested, It was actually requested on a scattered basis, so not all the funding becomes available July 1st. It's more of an implementation, I should say, a different implementation timeframe where they might go into effect in September. And then community capacity, actually, which I'll talk about, actually goes into effect next January. So the teams do have some time to put together some comprehensive plans and implementation, execution, they will have time to operationalize the plans. So let me talk a little bit about some of the plans. One of the easiest ones to talk about is jail-based restoration. This is a plan that we requested approximately $2.5 million for annually to support treatment in a facility other than the state mental hospitals for those individuals who were by the court deemed incompetent to proceed. The plan is to find a location. I know that you mentioned perhaps a jail. There are some other locations that are also being considered, Fort Logan being one of them. But these individuals have been court-ordered for treatment. And the thought is we would look for individuals that could be found competent to proceed with a limited amount of short-term treatment, 30 to 60 days. So if this would occur in a jail setting, which was part of the concerns that folks had expressed, that they would receive behavioral health treatment in a jail setting, the thought is it would not be a long-term. They would be individuals that could be found competent very quickly. And what this does enable us to do is to free up beds in Pueblo, as was mentioned, and it also will help with transportation costs and transporting individuals back and forth from Denver to Pueblo. It's likely that the location will be in the Denver metro area because that's where the greatest need for this type of service has been identified. The second one that I'll talk about is trauma-informed care. This one is near and dear to my heart for the very reason that I just talked about. We know that approximately 90% of the individuals who suffer from mental illness have suffered some level of trauma in their life. And instead of asking an individual, what's wrong with you, doesn't it sound much more appealing to say what's happened to you? And so with the support of SAMHSA and other organizations, trauma-informed care has become part of treatment plans for those with behavioral health issues. Having said that, we put forth an initiative to actually integrate trauma-informed care within our 2 state mental hospitals. It includes not only de-escalation rooms, so soothing rooms where individuals who are experiencing a high level of trauma, it's the anniversary of the day that perhaps their dear mother passed away, and it just triggers some emotion that makes them elevate. The staff would be trained to try the de-escalation room as a first source before there becomes an interchange between staff and patient or patient and patient. And these have been proven. We've had them at the hospitals. We just haven't had the number that we need to support all of the patients. And we received approximately $100,000 to support 3 new de-escalation rooms in Fort Logan and 4 new rooms in Pueblo. So we're really excited about that. In addition to those, we've also, and this is the bigger part of the ask, the total ask is about $1 million. The remainder of the ask, so about $800,000 to $900,000, is really to incorporate trauma-informed care services using peer specialists at the hospitals. So that will be a contracted service, which currently the RFP has been prepared already with the input of not only again leadership, office leadership, but also advocacy groups as well, to build the RFP and the request for those services. It also does include some state resources as well, some 2 licensed psychologists, 1 at each hospital, to actually manage those caregivers on campus. So we're really excited to release that RFP. I think it's going to be released by the end of this week. It's just in final approval. So those services will begin July 1st, so we're anxious to get those off the ground. Okay, the next one has to do with improving community capacity. The funding awarded for that on an annual basis is $8.4 million. That will offer us the capacity to deliver a better continuum of community-based treatment services and individualization of services and alternative living, residences, and housing subsidies and wraparound services. I haven't had lunch, so I'm tripping in my words. My blood sugar is kind of low. What I'd like to say about this is, again, there is a steering committee that has been formed that includes our community provider community, institute staff, and our own community programs group to figure out what these residences might look like. We have funding for 2 15-bed facilities, the location of which have not been determined yet. We would assume that there would be one in the urban, one in the rural areas, but again, that hasn't been determined. It's going to be based on need. The thought is that individuals that are leaving the Institute that are not ready yet to go into community but need a secondary level of care but not acute hospitalization would be transitioned through these programs. There's also housing vouchers that are included in this request, and we're excited about that because I think there's over 150 some vouchers that will be granted through this funding. The largest ask was for, again, the crisis services, which we talked about, and when we put forth the request, we actually had a limited amount of dollars that we were allowed to get to. So imagine our surprise when we had talked about mobile and transportation services that were in our original ask but couldn't be included because we thought that we only had a certain number of funds to go forward with. To imagine our surprise the day when the JVC actually referred and said, we want these services on top of what we had asked for. I remember we didn't know that they were going to ask for that, and we were listening to the call, and we had an open house going on, and we were so thrilled because we knew that it needed to include not only these 24/7 crisis centers, but also the 24/7 phone lines. It needed the mobile services and the transportation piece included as well. So we feel that we have a very comprehensive program and funding available to do that. So this group just actually wrapped up their input phase of the project last week. And again, they had participants from around the Denver metro area that support different parts of mental health to help develop what these services would look like. I should also mention that a piece of the funding also will support communication, so people will know what number to call. There's a significant amount of funds put aside for that as well, for a total of $25 million. And you've probably heard with this, we actually have a services bill that has actually been put into place, and it's in Senate, right now, it is in the approval process phase, and it will establish the funding and the statute to go forward with these crisis services. So we're really excited about that. So all of these plans together really help us to strengthen and improve our behavioral health system. And I'm really excited to be a part of this at this point. It's really exciting, and I'll just put a little spin on it. So we were asked to talk about how we might augment these services. So the office is actively coming up with some new ideas for even next year as we build these plans. So exciting times yet to come.
Cool.
I'll bait it with that.
Thank you.